HIV viral loads, only 41% of children living with HIV have suppressed viral loads. In 2021, there were an estimated 160,000 new HIV infections in children globally. It is further estimated that close to 1.3 million children and adolescents living with HIV aged 0 to 19 years globally are untreated, despite the fact that new testing technologies, including point-of-care, early infant diagnosis, and HIV self-tests are more widely available. And recently approved pediatric ART options are better and cheaper than ever before. Your Excellencies, ladies and gentlemen, in Tanzania, despite all the efforts and having endorsed the global recommendations on the elimination of mother-to-child transmission of HIV since 2012, and according to UNAIDS 2022 estimates, the current mother-to-child transmission rate in Tanzania stands at 11.1%. The country has recently completed the review of our elimination of mother-to-child transmission plan 2, and we have developed new EMTCC plan for 2022 to 2025 that targets triple elimination of HIV, syphilis, and hepatitis B virus infection. In the past decade, there has been several global efforts to address these challenges. For example, from 2011 to 2015, the global plan towards elimination of new HIV infections among children by 2015 and keeping their mothers alive, the global plan was largely successful in increasing national and global attention to the prevention of vertical transmission. Following the end of the global plan in 2016, the Start-Free, Stay-Free, AIDS-Free partnership was created to build on the initial success and expand the focus to include treatment for children and HIV prevention among adolescents and young women. However, despite some success, the Three Frees partnership had little global impact due to lack of sustained high-level leadership, limited funding, and inadequate engagement with national leaders and communities of women living with HIV. At this juncture, I would like to thank UNAIDS for initiating this new global AIDS strategy in 2021, but also for initiating the Global Alliance to End AIDS in Children by 2030. Your Excellencies, ladies and gentlemen, launch of the new Global AIDS Strategy in 2021 and the UN General Assembly 2021 Political Declaration on HIV and AIDS provides an opportunity to redirect our attention and redouble our efforts to end HIV/AIDS in children, necessitating the need for a new global alliance to end AIDS in children, which seeks broad participation of stakeholders, national governments, implementing partners, regional and country-based organizations, faith-based and community partners, including women and children and youth living with. I understand that each country has aligned their national priorities to the Global Alliance Framework to End AIDS in Children by 2030. I'm very excited that this afternoon we will announce the Dar es Salaam Declaration, and later the Ministers of Health will commit to prioritize the implementation of impactful intervention. Your Excellencies, ladies and gentlemen, before I conclude my remarks, allow me once again to applaud the Global Alliance Initiative partners and all the 12 countries at large on the tremendous progress we have made together in reaching where we are today. This has been driven by smart investment and treatment policy changes that we have made. I take this opportunity to thank the Global Fund, PEPFAR, civil society, and faith-based organizations for attending this important event. We count on your partnership in the implementation of actions that the countries have developed. Finally, allow me to take this opportunity to invite each one of you to visit Zanzibar and our great national parks as Ngorongoro, Serengeti, and Mikumi National Park, which is around the corner, where you will see, hug and take selfie, lions, elephants, giraffes, buffaloes, rhino, and much more, as well as meet our generous people. Asanteni sana. Thank you very much for your kind attention. Thank you.
Umi for the remarks. Thank you very much, Honorable Umi, for the remarks. Now I have the honor to welcome His Excellency Retired General Dr. Constantine Chiwenga, Vice President and the Minister of Health and Healthcare in the Republic of Zimbabwe. Karibu sana. Just greetings. Thank you.
Honorable Minister, our guests, our hosts, Honorable Minister of Health of the United Republic of Tanzania, Honorable Mwalimu, Honorable Ministers, ladies and gentlemen, good morning. Let me first express my gratitude to Her Excellency the President of the Republic of Tanzania, Samia Hassan, for graciously extending an invitation to us to attend this very important meeting. Today we are meeting, and at the end of the day, we should be able to come up with other brothers and sisters on our continent and beyond on how to deal with this pandemic. It's not yet over. In our case, Zimbabwe has a population of 15.1 million, and 1.1 million where are people living with HIV and are currently receiving antiretroviral treatment. And 52,390 are between the ages of 0 to 14 years, which means these are children. They need to be protected. Whilst the antiretroviral therapy coverage is now at 94%, I still note with great concern that the antiretroviral treatment coverage in children and HIV-positive pregnant women remains low at 73% and 87% respectively. And therefore, we also got affected, just like any other country, when the pandemic hit us of COVID-19. People concentrated on treating and protecting the spread of COVID-19. And we had completely forgotten about the HIV/AIDS, that we were still with it. Now, as an example, we had a rise of 5,000 in our country for people, new infections, which then had a vertical transmission rate of 8.9%, and yet we had intended to see it going down. The mother-to-child transmission rate on HIV/AIDS, we had wanted it to go down, and we still want it to go down to below 5%, and eventually be able to eliminate it. So, at the end of this meeting, honorable ministers and our UN family and our partners, let us come with concrete measures which will make sure the spread of this pandemic is brought to a halt. We have, in Zimbabwe, we have come up with various pillars to guide us. Like the first one is to scale up access to a point of care of early infant diagnosis and ensuring availability of the best treatment options for HIV-infected children and adolescents. And the second pillar is on improving service utilization by pregnant and breastfeeding women and addressing the needs of adolescent girls and young women. And the third pillar is on testing, strengthening the testing and retesting and preventing new infections, particularly among adolescent girls and young women. And the fourth pillar is to strengthen involvement of people living with HIV. We have been concentrating on women and children, but it takes two to tango. We should never leave boys and men. They must be included if we are to eradicate this pandemic. So I see all our efforts for all along has been to concentrate only on women and children. But the causes of these are boys and men, and we want to leave them as though they are saints. I think we need to include them. That's what I would want to encourage honorable ministers, members of the UN family, and our partners, that we take all these groups and make sure we go forward with them if we are to eradicate this disease. The family, the religious groups have to take effective part in the fight to deal with this pandemic. We need to finish it by year 2030. I thank you.
Thank you very much, Your Excellency, for your remarks. I now have the honor to welcome Winnie Byanyima, the Executive Director for the UNAIDS. Karibu sana.
Thank you very much. Good morning, habari asubuhi. Honorable, my sister, Honorable Umi Mwalimu, Minister of Health of the Republic of Tanzania. Thank you once again for Tanzania, for making Tanzania the first country to join the Global Alliance when we spoke in Geneva in May last year. And thank you again for hosting this alliance for its first meeting in your beautiful country. Honorable Ministers, country representatives of the 12 countries who have joined the alliance in this first phase, and that is Angola, Cameroon, Cote d'Ivoire, Democratic Republic of Congo, Kenya, Mozambique, Nigeria, South Africa, Tanzania, Uganda, Zambia, and Zimbabwe. And of course, I must make reference to the delegation from Namibia, whose First Lady will be with us in a little later. My colleague, Zlatan Milicic, the United Nations Resident Coordinator in Tanzania, international partners, UN and UNAIDS colleagues, and the amazing civil society leader, Prudenciana Gwiliza, whom I met yesterday, and the many representatives of civil society and communities in this room. Good morning. I'm delighted to join you at the start of this important meeting. Let me start by congratulating the governments of the 12 countries. They are from the 2 regions that are making, that's West Central Africa, East and Southern Africa, that are making the fastest progress towards ending AIDS. So ministers and government representatives, thank you for your efforts. We know why we are here today. We are here to end the appalling injustice, which is that last year, 96,000 precious children died because they were not on treatment. The injustice that 160,000 children were infected with HIV last year, and that just over half of all children who are living with HIV today in this world, only a half of them are on life-saving treatment, when in fact for adults it's 3/4. 75% of adults that are HIV positive in the world today are taking treatment, but for children it's only a half of them. This is an injustice. With the science and the drugs that we have today, no baby should be born with HIV. No baby should get infected during breastfeeding. And if a child lives with HIV, then that child should be on treatment and living a healthy life. So we must close the treatment gap for children to save children's lives. I'm confident that the action plans that you have made in your countries, for each country, and that you have been finalizing since yesterday, will be instrumental in closing these gaps. So thank you for them. This, I believe, is a winnable fight. We can win it for all our children in this region, in Africa. We can win it for their mothers. We can win it for their families. We can win it for our countries. We are going to see the results quickly if we apply ourselves. This is low-hanging fruit. It's doable. We can make the impact. We can see the change happening in a few years. The honorable ministers, make it your priority. Make it something you will win on in your term in office. Here is where it starts, and I have some asks of you, honorable ministers. Priority are maintained. It's going to be tough. We will support you with advocacy, arguing for the investments in health and in fighting HIV/AIDS in children. We will be there with you. Second ask, our strongest funders for the AIDS response are Global Fund and PEPFAR, as you heard the minister mentioning them. Commit, honorable ministers, to include funding for ending AIDS in children in your Global Fund and PEPFAR proposals. Make it a priority in there so that our strongest financial partners allocate for it. The third request, communities. Communities are key. We have the evidence for that. Invest in community-led services. This will connect us in the global response, but actually connect us in the global response, but actually invest in them, reward them better so that they can do this work to find our missing children and get them on treatment. Another request, move fast to adopt the latest policy guidance available, including dolutegravir for children. Moving fast to apply the scientific policies that give the best treatment for children. But then, this is my last request, drugs alone cannot do it. Many of the reasons why to get all the children on treatment and to stop new infections. It will take mothers, it will take rights of women and rights of children. So, honorable ministers, it will take your partners in government, ministers of gender equality, women's affairs and children affairs. It will take social development ministers. It will take your partnership with them. I encourage you to make those partnerships, to bring them in to fight to end AIDS in children. Partnerships, to bring them in to fight to end AIDS in children. On our side, UNAIDS, the United Nations, the joint partnership, we are a partnership of 11 UN agencies. I want to reassure you that at the national level, at the continental level, at the global level, we will be there to support you. Our leaders in this effort are WHO and UNICEF, but 11 of us are solidly behind you to support you to achieve this goal. With this, I want to say, this global alliance that you are launching today, we will see it shift the needle for our children, and we will end AIDS in children. Thank you so much for your attention.
Thank you very much, the Executive Director for the UNAIDS, for your remarks. I now would like to invite 𝒓𝒊𝒈𝒉𝒕🔂, the chairperson for the Organization for Youth Living with HIV/AIDS. Karibu sana 𝒓𝒊𝒈𝒉𝒕🔂.
Good morning, everyone. Your Excellency, Retired General Dr. Constantine Chiwenga, Vice President of Zimbabwe, Honorable Ummy Mwalimu, Minister of Health, United Republic of Tanzania, Honorable Mama Winnie Byanyima, UNAIDS Executive Director, Honorable Fatma Taufik, Chairperson of Parliament, Standing Committee of HIV and TB, Parliament of Tanzania, representative of Peer HIV, event is observed. Honorable guest of honor, first and foremost, I would like to take this opportunity to express our greatest gratitude to Almighty God for His wonderful day and for this incredible congregation. I also appreciate the President of United Republic of Tanzania, Her Excellency Dr. Samia Suluhu Hassan, and the government for the incredible children, adolescents, girls and young women. We are grateful to be part of the entire process for the Global Alliance to End AIDS in Children. We are proud of the significance against the elimination of new HIV infection can be accelerated. Honorable Guest of Honor, in ending new HIV infection among children, it is important to note that adolescents and young people are important change makers in sub-Saharan Africa. Sexual active adolescents and young women are at high risk of contracting new HIV infections. It is unfortunate that most of them do not adhere to HIV treatment, which is the route to increase HIV vertical transmission. There must be debatable efforts to ensure that there is improved adolescent and young people intervention and service to help identify and retain more adolescent and young women living with HIV in treatment. This can be achieved by improving HIV-friendly service in our health facilities, meaningful and ethical engagement of youth, strengthening peer-to-peer intervention, improving the capacity of youth and youth-led organizations to reach more adolescents and young people, and allocating more resources to adolescents and young women in HIV program. Honorable Guest of Honor, HIV, stigma and discrimination, and increased inequality in our community have negatively impacted the HIV response. Girls and women are experiencing gender-based violence, but also key and vulnerable population is still high. It is unfortunate that there is low prioritization in action related to stigma and discrimination, especially among key and vulnerable population. Some societies in sub-Saharan Africa still harbor these harmful tradition norms that widen the gap of inequality. There is a need of strengthening community system and on HIV intervention to address inequality inclusively and strategically to help end AIDS in 2030. Economic vulnerability among youth is also a major challenge in HIV response. Many vulnerable adolescents and young people, especially from rural areas, are at high risk of contracting new HIV infection, and others fail to remain in effective ARV treatment. This also must be addressed by ensuring there is sufficient investment in community intervention which focus on economic empowerment. Girls and women need to be empowered economically to reduce their economic vulnerability while equipping them with the right HIV prevention and treatment information. Honorable Guest of Honors, it is the higher time now to address the challenge by ensuring we meaningfully engage young people, especially adolescent girls and young women. We also need to close the treatment gap for pregnant and breastfeeding women living with HIV and optimizing continuity of treatment toward the goal of eliminating vertical HIV transmission. Furthermore, preventing new HIV infection among pregnant and breastfeeding adolescents and young women, addressing gender equality and the social structures barrier that hinder access to HIV service should also be our priority. Honorable Guest of Honor, the government and other key stakeholders should remember that there is still work to be done to empower and build resilience among adolescent girls and young women to ensure that significant contribute to ending new HIV infection in children. I take this opportunity to emphasize and encourage all of us to continue fight against gender-based violence and inequalities, in which adolescent girls and young women face across the country in sub-Saharan Africa. Therefore, it is everyone's duty to fight for the rights of adolescent girls and young women, particularly in the areas of health service and parenting, which will be translated in with HIV and AIDS. We will be at the forefront to join the local and international community effort in the fight against ending HIV and AIDS among children. Before I leave this table, I want to say something. I, 𝒂𝒂𝒔𝒂𝒇𝒊 I'm living with HIV, but I have a son aged 1 year, but he's free from HIV, and I'm so proud of that. Thank you for listening.
Good morning, Your Excellencies. I want to recognize you, my dear sister and minister, our host, Honorable Minister Mwalimu, Minister of Health of United Republic of Tanzania. I would like to recognize His Excellency, the Vice President and Minister, Honorable Dr. 𝒂𝒂𝒔𝒂𝒇𝒊 of Zimbabwe. I also want to recognize our honorable ministers here with us, the Minister of Uganda, the Minister of Angola, the Minister of my home country, Kenya, who are present here, as well as other representatives who are sent by ministers. Excellencies, we have in the room representatives from many, many countries. I don't know if you would give me a moment to ask them to wave or just say that they're here present, because we have all the countries present in the room. Let us start with Angola. Angola in the room? There is Angola in the room. Thank you, Angola. We have Cameroon in the room. We have a representative from Cameroon in the room, 2 representatives, thank you so much. We have Côte d'Ivoire in the room. Côte d'Ivoire, show yourselves. Thank you so much. We have the Democratic Republic of Congo also in the room. Thank you, the Democratic Republic of Congo. Your Excellencies, this is the country where I reside, and Nigeria are also in the room. Thank you so much. We have Tanzania is in the room. Yes, in large numbers. We have Uganda in the room. Thank you so much. We also have Zambia. And we have Zimbabwe in the room. Your Excellencies, we also have Mozambique in the room. And we also have an honorary country that has joined us as a special country, as an advanced team for the phase 2 countries. Namibia is in the room also. Thank you so much. My name is 𝒂𝒂𝒔𝒂𝒇𝒊. I'm the UNH representative, regional director for East and Southern Africa. I also have my sister who is from West and Central Africa, 𝒓𝒊𝒈𝒉𝒕𝒔, who is also here with us. And I am co-moderating with Dr. Catherine Joachim. We are now going to invite Shalina Bahugana from the UNICEF representative in Tanzania, who will take us through the next section. But I just wanted to make a comment just to prepare you as Shalina comes up. You will see that in the program, we've had to adjust the program because of the time, as you understand. And so we will not have what is written there as the country commitments for change in this morning section. Instead, we will merge them into the later section from 11:30. And so I just want to alert the country.
Asante sana. Habari za asubuhi, good morning, assalamu alaikum. Catherine Russell, the Executive Director of UNICEF, and to commit wholeheartedly with Dada Winnie that we are together with all the UN agencies to end AIDS in children in 7 years, which, ladies and gentlemen, and young people in the room, is only 2,525 days away. I've taken off January, so our clock is ticking. But as Winnie rightly said, we can do it. We can win the fight. We have shown what we did with the COVID vaccine. In this country, with political will, with financial commitment, with engagement of all partners across the board, and most importantly, with community engagement tackling social norms, we have come from behind with Mama Samia and Minister Umi's leadership to get to over 90% of people over 18 vaccinated. So if we can do this, we can also hit our goal for the 2,525 days. Having said that, let me move swiftly on. You will see in the video the theme of this session, which is leading with communities at the center. Karibu for the video, please.
My mother is a photographer. She took these. She loves taking photos and loves telling stories. They are about HIV.
There have been so many sad stories. Even though I know they are real, I sometimes find it hard to believe.
For 40 years, there have been so many stories of loss and despair, of fear and stigma of discrimination.
Some of these people look so sad.
But there was also hope. People changed laws through activism and political struggles, and there are so many scientific breakthroughs.
Do you believe we can end AIDS for children?
Today, AIDS care is not as costly or complex, but still challenging. Even with all the achievements, sometimes I look at the photo and think the world has forgotten that HIV pandemic continues.
There's still so much to do.
These photos tell stories of many people who no longer face death from AIDS. My mother's photos tell the stories of people who need a blueprint for change.
We need to remind the world of their promises and commitments.
And so many people have joined this fight against HIV and AIDS, because the world's largest challenges need the world's largest team.
I like these photos. Wow.
We do not get to choose what we face in our lifetime, but we just get to choose how we respond. It's time to galvanize action, build on lessons learned, and realign programs to meet the ambitious targets agreed in the declaration. And we must now come together to commit to implement the blueprint of the Global Alliance over the next 9 years.
I believe we can do it. What should we hang here on this view?
Well, today, at the launch of the Global Alliance, You will all decide together what hangs on the wall.
We need to believe that together we're going to end AIDS in children, once and for all.
We can end AIDS in children once and for all, and we will do this in the spirit of working together with the communities and in partnerships. So it is my privilege to invite 𝒓𝒊𝒈𝒉𝒕, Executive Director, Sante, and the International Civil Society Institute, the civil society representative for West and Central Africa, to please come and speak a few words. Karibu.
Honorable, Your Excellencies, all protocols observed, ladies and gentlemen. First, may I pay tribute to Tanzania. Asante sana for hosting this important gathering, one which carries such weight. Out of the 10 children living with HIV in the whole wide world, more than 8 reside right here in our continent, our dear Mama Africa. Unacceptable. With this being said, I would like for all of us to take a moment to look at each person sitting or standing next to us. Let us look at them very closely and imagine for just a minute that they are either a child or an adolescent. We often worry about what a child will be tomorrow, yet we forget that he is someone today. We forget that he is someone today. What are the current numbers of HIV telling these children and adolescents? Or should I say our children and adolescents? These numbers are telling them that we, the adults, are still not doing our part. That our priority lies elsewhere. That we are failing them, day after day after day. We then begin to ask, why is this happening? Why is it that we can only identify 60% of children living with HIV? Why is it that only half of them receive this effective, available, and well-deserved treatment? Why is it that in West and Central Africa, my region, close to 65% new HIV infections are from mothers who did not receive ART during pregnancy or breastfeeding? These are the same questions that we need to make sure their children never have to ask them. The only question worth asking should then be, how? How did you end AIDS in children? I personally know what my ideal answer would be. I would say to them, we ended AIDS in children when the women and the men in charge ensured that we had the political and financial commitment of our countries, the effective involvement of all community actors at all levels and stages of the response, a strong civil society to ensure the control and the monitoring of our common goals. What would your ideal answer be? And more importantly, what steps are you taking towards making this happen? How are you working for the optimization of children and adolescents' treatment, care, and identification? How are you strengthening collaboration with CSOs and engaging with parents and men? How are you advancing health equities? How are you empowering the youth who form networks and speak for themselves? We often say that it takes a village to raise a child. I urge you today, I urge all of us to be that village. Let us be accountability partners for each other as we move towards implementation of the Global Alliance Initiative. Ending AIDS in children is not an option, it is a necessity. Thank you.
Thank you, Ngisali. Rightly said, this is not an option, this is essential. And let me also add what you said on accountability and mutual accountability and echo it with the spirit of partnerships at the community level. Those of you familiar with Kiswahili know this, and Mama Samia has said this many times, peke yako unatembea haraka, lakini pamoja mnatembe mbali. So together, especially together with civil society, we will reach our aims. So with that, let me invite Lillian Morocco, and she's the Executive Director of the International Community of Women Living with HIV in Eastern Africa. Karibu sana, Dada Lillian. Asante sana.
Honorable Ministers present, Winnie Byanyima, and all protocol observed. Ladies, gentlemen, and others, ending AIDS in children by 2030 is possible and within reach. I don't want to repeat what has been said. We talked about statistics. We committed for the last several months since Montreal. Yesterday we recommitted, and we are here today to commit again to ending AIDS in children by 2030. Representing the global networks of people living with HIV, International Community of Women Living with HIV, the global network of people living with HIV, and the global network of young people living with HIV, I want to recommit that as communities, we are ready to end AIDS in children by 2030. About 14 years ago, when we didn't have the tools that we have today, when we didn't have the resources that we have today, and when we didn't have the people that we have today, I was able to deliver a child who is negative. 3 years later, I got another one who is negative. Today, it is a pain when I stand here in front of you and we are talking about children who are being born with HIV. We know what works. We have the tools, we have the resources. What we lack is the commitment. We are betraying children. We are denying them a right to live free from HIV. and we continue to get in boardrooms to speak to ourselves when we know the children are not in this room. If they were in this room, they would be saying something different. We can end AIDS in children. We continue to talk about loss to follow-up. We continue to talk about so many things, but we know where these children are. We know these children are not in the bush. These children are with their mothers. They are with their parents. They are in their homes. And we know why the mothers are not bringing these children for care. But we also know, like I'm telling you, there's no mother who would dream, who would want to have a child who is HIV positive. If there are mothers in this room, if there are parents in this room, you know what I'm talking about. That it is not anybody who has gone to labor that wants a child who is HIV positive. When it happens, there must be reasons. And those are the reasons we must address. Commitment requires us that we put those children in our spaces. Think about that child. That child will never forgive any of us. They may forgive the world, but they will not forgive us. That we had the sole resources we need, that we have the tools, and they continue to be HIV positive, it is unacceptable. So ladies and gentlemen, we have a call to action. That we are committing as women and communities, that we want to lead this response in ending AIDS in children. Invest in us, partner with us, hold us accountable when you have given us what we are asking and what we are recommending, so that when we come back here next year or 2 years to come, you ask us, how did you continue to have babies who are HIV positive? Address stigma and discrimination. Address the legal environment. Let's be the champions of ending AIDS in children. Thank you very much.
Asanteni sana, that was a wonderful session. Can we give them a hard round of applause from our partners? Thank you so much. You will please bear with us. This is a moving program. I now have the pleasure of introducing our UN Resident Coordinator, Bwana Zlatan Mileshik, who is our leader here for the United Nations here in the United Republic of Tanzania. Welcome.
Asante. Excellency Dr. Constantine Chiwenga, Vice President of Zimbabwe, our host Honorable Umi Mwalimu, Minister of Health of United Republic of Tanzania, and our other host, Honorable Minister Nasser Mazrui, the Minister of Health of Zanzibar, Tanzania. Honorable Ministers of Health from the countries members of the Global Alliance to End AIDS in Children. Winnie Byanyima, Executive Director of UNAIDS, partners and supporters of the Global Alliance to End AIDS in Children, from the governments, from the civil society, from the United Nations, invited guests, ladies and gentlemen, habari za asubuhi, good morning. The United Nations system in Tanzania is working in strong collaboration with the government and with the civil society organizations to achieve the 2030 Agenda for Sustainable Development. Our coherent plan is our United Nations Sustainable Development Cooperation Framework for Tanzania 2022 to 2027. One of the 4 outcome results of that cooperation framework is that by 2027, the people of Tanzania, and especially the most vulnerable, increasingly utilize quality, gender transformative, inclusive, and integrated basic education, health, nutrition, protection, and other social services. Under health, a particular focus is given to mother, newborn, child, and adolescent health, and HIV, as well as epidemics. Social protection systems and services are being strengthened for expanded and improved coverage of the most vulnerable, including women, children, and youth. In this regard, we consider the aims of the Global Alliance to End AIDS Among Children as a timely strategic initiative that the UN agencies, UNAIDS, UNICEF, and WHO in particular, but as we have heard, it's a coalition of 11 organizations that work closely in AIDS, that we are promoting in collaboration with the governments of 12 countries in Africa and also other partners. The UN in Tanzania will continue to provide the necessary technical and other support to ensure that more effective, efficient, innovative approaches are applied to achieve the targets of eliminating mother-to-child transmission to below 5% and of increasing antiretroviral treatment coverage up to 95% by 2025. Although Tanzania has done a very commendable job of rolling out antiretroviral drugs over the years, there is some disparity between the percent of adults that are now receiving ART, 87%, and children, 60%. In addition, there is an estimated 11% mother-to-child HIV transmission rate, including breastfeeding period, while the target is, as we said, 5%. Women face a disproportionately high HIV burden, and the disparity is most pronounced among adolescent girls and young women aged 15 to 25 years. They are 2 to 3 times more effective than their male counterparts. These statistics justify the need to renew efforts by all stakeholders, governments, development partners, civil society, private sector, to achieve the desired goals of eliminating mother-to-child transmission and realizing equitable coverage with antiretroviral treatment, including for children, or I should say, especially for children. This will not happen, however, without addressing the key factors that cause the vulnerability of children and women to HIV. Women face gender-related disparities that largely stem from socioeconomic gender inequalities, harmful gender practices, including gender-based violence. We recognize the commitment of the governments to swiftly adopt evidence-based policies and best practices to ensure people living with AIDS have access to HIV testing and the best drugs for treatment, and that they adhere to treatment, and that they stay in care. But there is still a long way to go to achieve the SDG target of ending AIDS by 2030. We are confident that the country action planning for global alliance that has been taking place over the last several months has charted transformative strategies to enable countries to achieve the target of ending AIDS among children by 2030. I would like to call on all stakeholders to embrace and support and resource these plans. Asanteni sana. Thank you very much.
Thank you very much, the UN Resident Coordinator, for the remarks. Now the next session will be on getting the updates on the Global Alliance key guidance and policy. And I'd like to invite Shafiq and Meg to lead us in this session. And after that, I'll press Shafiq to give us an overview of the Dar es Salaam Declaration to End AIDS in Children, which will later be read by Honorable Umi Mwalimu. Thank you.
Thank you very much. It's a pleasure and an honor to stand in front of you today, Your Excellencies, distinguished guests and colleagues. This has been a lifelong work for me. I've been a pediatrician at the front line of the AIDS epidemic for over 20 years. And this is a great day when we are able to make these commitments to end AIDS in children once and for all. So we're going to walk through with my colleague Meg Doherty a few slides that will serve as an introduction to the Global Alliance and show you some of the progress that we have been making in our efforts to bring us to this point. If we can have the first slide up, please. We seem to be having some technical issues. There we go. The next slide, please. We've heard many of these statistics already this morning, but I think it's worth underscoring the inequity that exists between adults and children. Despite the impressive progress, we are off target in terms of both HIV treatment and prevention for children. The graph on the left shows you that coverage of antiretroviral treatment in pregnant women has essentially not changed at the global level for the last 7 years. So that progress was all earlier on. We're not seeing ongoing progress in trying to prevent vertical transmission of HIV to children. And whereas over 3/4 of adults are on treatment, for children that number stands at just over 50%. The gap is actually widening, and we now have close to 1.2 million children and adolescents who are not on treatment, and we all know that the likelihood of those children surviving is very, very low. The world is beginning to take notice, and in the next slide, we see one of the examples of how this is beginning to happen. This was a story that was in the New York Times just about 2 weeks ago on the front page of the New York Times, which highlighted how the epidemic response has left children behind and showcased the fact that over 100,000 children are dying of AIDS every year. So how does this galvanize us into action? And in the next slide, we see that the Global Alliance to End AIDS in Children is a successor to the work that we have done for the last 15 years in the global plan and with the 3 Frees. We've framed it as a global strategic initiative that will take place in three-year phases across 4 critical pillars of work. The first of these is testing and treatment for children, which is essential to close that treatment gap. The second is ensuring continuity of treatment and making sure that those remaining women who are pregnant and breastfeeding and living with HIV but not on treatment do get access to services. The third is preventing new infections among pregnant and breastfeeding women and girls. This is an important source of new infections in children and is something that we have not been adequately addressing to date. And the critical 4th pillar, which is a cross-cutting pillar, is to address some of the structural barriers that continue to hamper access to children. The next slide shows us a little bit how we want to do things differently. So although we are standing on the shoulders of the 3 Frees as well as the global plan, we've taken some novel approaches in structuring the Global Alliance and in the work that we've done. First and foremost, it's the presence of all of you in this room. The country leadership and the community ownership shows us that we're taking a ground-up approach and we're putting you in charge of leading, developing, and executing on these plans. We also want to place women, children, adolescents, and communities at the very center of our work, and we want to boost existing initiatives to end AIDS in children, with a commitment to coordinate and celebrate our shared success. And finally, even though we are focused on program issues, I want to recognize the structural barriers that are critical to hampering our progress. The Honorable Vice President mentioned the important role of gender-based violence and the role that men have to play in preventing and protecting women from HIV. These are the kinds of things that I think that fourth pillar will hopefully address in a concerted effort. In the next slide, we see a little bit about how we are structuring the alliance, placing women and children and adolescents at the center. And within this structure, one thing that I think is worth pointing out is the fact that the country teams are an essential part of the core of our work. So this is not a top-down effort. It's something that is being led and driven by countries and by the teams at country level. The next slide, please. As I mentioned at the start, this is going to be rolling out in 3 phases. Currently, we are well underway in phase 1, and the focus during phase 1 is on high-burden countries. But this is a global effort, and the effort must go beyond the African continent. And so in the subsequent phases, we will take stock of our successes